resist. Again, welcome. Thank y'all so much for being here. This is our well talk on grip strength, and our lovely therapy department with Trinity Rehab has graciously accepted the invitation to be here and present today. So let's all give them a warm welcome.
Thank you. Hello, everyone. I'm Stacy. Let me get this ready because I'll forget to click it. It's just this one. Okay. I'm Stacy. I'm fairly new. I started in February, but I've already met a few of you. So I'm from occupational therapy. We also have Jenna from occupational therapy. Our occupational therapy assistant, Allie, is out right now, but she is also part of the team. And then, of course, you know Adrienne, our rehab director. Okay. So if you can't see the slide, it says, "Get a grip, a key to healthy aging, how hand strength affects health and daily function." And there we are. Okay, what is occupational therapy? Has anyone had OT in here before? Yay. Okay, about half of you. You might ask yourself, what is occupational therapy? What's an occupation? You might say, oh, I already have a job. I don't need to go to therapy. Or I'm retired, I don't need a job. But an occupation is a meaningful activity. It's something we do, something we need to do during our day, or something we want to do or have to do during the day. So different occupations can be just going to the bathroom, getting to the toilet, playing bridge, pickleball, walking to the dining room to socialize with friends, and even for children, playing, handwriting, or even learning how to regulate their emotions. It's all just what's meaningful to you that you need to be able to do during your day. We also, in occupational therapy, will say, what are your goals? What do you do during your day? What do you have to do? What do you need to do? And what do you want to do? So we try to help people get back to what they're doing, or learning a new skill if you need to relearn it, or if you hadn't learned it before. Let's see if it's working. Okay, here's a picture of the hand. It's really tiny, the word, so we're just gonna look at the picture. But what is grip strength? Grip strength plays a vital role in many activities, and we will also be talking about how grip strength can be an important indicator, biomarker, or assessment for your overall health. So your grip strength is powered actually a lot by your forearm muscles. You use your forearm and your hand together to grip things. And I'm gonna read the muscles. They might not mean anything to you, but in the forearm you have your flexor digitorum superficialis. It helps bend the fingers. Flexor pollicis longus helps flex your thumb, and a lot of these forearm muscles start up here, but they go through the wrist into the hand, so they do help your hand move. Another forearm muscle is the brachioradialis, and it helps with elbow flexion and helps stabilize your forearm when you're trying to grip something. And then in your hand, you have your thenar muscles, which makes up the base of your thumb. Your hypothenar is where your pinky is. Your thumb, well, the thenar muscles, it's good for thumb movement and opposition of the thumb, which means like pinching something. And the pinky side will help you hold like a wider object or stabilize a bigger or wider object or heavy object. And then you also have these little muscles in your hand, the lumbricals and the interossei, for like more fine-tuning coordination and adjusting to different shapes. So all of that goes into gripping something. Okay, what is grip strength? It's a measure of muscular strength, or the max force generated by the forearm and the hand muscles for things like opening a jar, carrying shopping bags, holding a walker or a cane, turning a doorknob, using utensils or cooking tools, or buttoning clothing. Can anyone else think of something that might require grip strength? Julie? Writing, yes. Sewing, I wrote down sewing too. Knitting, yes.
Taking something off a shelf.
Yeah, just getting something out of a cabinet. And playing cards, being able to hold some playing cards in your hand, or pickleball, bocce ball, stuff like that. Even driving, holding the steering wheel, and climbing stairs, like holding onto the railing to pull yourself up is a good one. There's different types of grip. I don't have them up here, but there's a crush grip, which is like when you are going to shake someone's hand or hold something or squeeze something. A support grip, when you have to kind of suspend yourself. Like let's say you had to pull yourself up from the floor from like a grab bar. That's kind of, you're pulling all your weight up on that. And then also there is like a pinch grip. So that's when you have to have like a flat hand and a thumb to pinch something, either with your fingers or your whole hand, like it's like a flat object. So there's all different kinds of grip. And why does it matter? It reflects your overall muscle strength. It's an important indicator of overall health. It supports your independence and safety with ADLs, and that's your activities of daily living, or the things that are important to you during the day, like dressing, bathing, cooking, household chores, medication management, leisure activities, and hobbies. Grip strength can reflect your overall muscle strength, your upper limb function, your bone mineral density, fractures, falls, malnutrition. It can even be an indicator of cognitive impairment, depression, and all of these things can affect quality of life. So it's kind of amazing what we can not necessarily prove with grip strength, but it can just be an indicator that something else is going on, or that it can lead to something else. Let's see if I can flip this one. Okay. And this is just kind of more information of how grip strength is important for your health. There's something called sarcopenia, which is natural age-related loss of muscle mass. So as we age, we just naturally lose a little bit of that muscle. And then dynapenia is the loss of muscle strength. So you might not be atrophying, but you're losing that strength. So when we measure your grip strength, it can be an indicator that you're just having some general weakness. Maybe you're having that sarcopenia showing through. It can also be, grip strength can also help us if you have like a hand, wrist, or arm injury and you need to recover from that. Those are things that OT will definitely work on with you. Or if you like were to fall with an outstretched hand and like sprain or strain yourself or break anything, that grip strength will be very important to regain. A lower grip strength can be an indicator of malnutrition, sarcopenia, like we just said, dynapenia, even neurological conditions, which can then cause general weakness, walking limitations, gait abnormalities, or put you at higher risk for falls and injury. And a stronger grip can actually be like correlated with walking faster, getting up from the chair easier, having better balance, decreasing your fall risk, and just keeping you independent for longer. Okay, more research about grip strength. Studies have shown that weaker grip strength is associated with increased disability, longer hospital stays, more difficulty recovering after illness, and a higher risk of needing assistance with daily activities. So just really needing more help and not being able to go back to being as independent as you were. Okay, grip strength and falls. We kind of touched on this a little bit. Grip strength can be connected to your leg strength, your walking speed, your balance, and just your overall confidence with mobility. So you will see us checking grip strength in the gym a lot with people and doing a lot of like hand exercises, and I think Jenna will get into those later. Does anyone have any questions so far? I know I'm throwing a lot at you, but basically we like to focus on grip strength a lot with occupational therapy because of some of these indicators with general weakness and just putting you at higher risk for falls and injury. We like to use the dynamometer for our evaluations, and we just try to get you as strong as possible in your upper body for these reasons. Yes, Julie?
I'm having difficulty in sewing and writing it. I don't want to lose that. I use that squeeze ball.
Yeah.
Is that effective?
Yeah, so that is a good like general strengthening exercise. Of course, it might not be the only reason why you're having trouble. It could be more like coordination issues, but it cannot hurt you to keep doing those strengthening exercises with the ball squeezes or any kind of resistance squeezer you have. Yeah, good question. Keep doing what you're doing. Any other questions so far? Okay, I think I'm gonna turn it over to Jenna.
I have a question.
Yeah.
How does grip strength help with balance?
So sometimes if you
Use the mic.
oh, sorry.
Yeah. I don't understand how those are really connected.
Yeah, it could be a few different reasons. If we are testing your upper body and we notice some weakness, it could be a sign, not just of general deconditioning, but they could be more nerve-related signs, neurological signs, which would then affect your overall balance. Or if you just have some weakness, it could be affecting your arm swing when you walk and throw you off balance-wise. And if you have weakness in your upper body, you just might be a little more hesitant because you don't feel as strong and confident. So those could be a few reasons why it might throw you off a little bit. Great question.
Yes. Okay, so there are many reasons why why you might lose grip strength, and some are just normal aging, like we said earlier, but also some causes could be arthritis, so joint pain or poor joint space, previous injuries, stroke, diabetes, as mentioned, nerve problems, lack of exercise, lack of mobility, poor nutrition, or if you've had a hospitalization. Okay, so we're going to talk about how we measure grip strength. There is a handy tool called a dynamometer, as pictured there. And that's how we measure it objectively. So this is going to give us a number in pounds. So, 10 pounds is your grip strength, 20 pounds. And then other ways we can measure more subjectively, it would be like the quick dash or an upper extremity functional scale. Those are going to be kind of questionnaires where you're going to indicate, and it's going to just tell us how it's affecting you more subjectively and how it's impacting your daily functional performance.
What's that stand for?
Oh, good question. It is the arm, shoulder, hand. The something.
disability index of the arm, shoulder, and hand. So we might also use this if you come for us for shoulder pain or any kind of upper extremity pain. But this is also if you have weakness. Okay, so with the dynamometer, which we have one here today, but what we do is have you squeeze 3 times on the right and 3 times on the left. We take an average to get the number for your right and for your left. And so here we just have some numbers. So for men age 70 to 99, anything less than 21.3 pounds would indicate weakness. And then for women, 14.7 pounds. Okay. But the good news is that strength often improves with regular activity. And it can also be improved with proper nutrition. You know, you want to get your calcium, your vitamin D, your protein. And then also we have many different tools and devices to help assist with that as well. And we have brought a lot of them. We're going to have some time at the end for everyone to come and check those out. And then we also brought some little giveaways to take home for you guys too to try out. So, yeah, so it doesn't require, any fancy equipment, but the key is consistency. So some exercises include squeezing a stress ball, using therapy putty, pinching clothespins, rubber bands, and wrist curls with weights. So it doesn't take, fancy equipment or fancy exercises, and it doesn't take a whole lot of time, but you can improve your grip strength.
What are they doing in the pictures?
Which one?
Both of them.
So the top right, I wish I had, is
No, the bottom.
oh, that's a weight in their hand, and they're holding it, and they're doing wrist extension.
Like a table.
Oh,
Yeah, and then
So
wrist
this way,
flexion.
And you can do it this way.
I see.
Hmm. Because strengthening the muscles in the forearm, as Stacy said earlier, will strengthen your grip. And then, sorry, let me go back. So the stress balls, as many of you probably have one already, but please take one. We're going to give out stress balls at the end. Those are helpful for gripping, pinching. They give resistance. There are some stress balls with different resistances. Like there's some that are lighter and then moderate, heavy. I brought some of those as well. Same with the Digiflex here in the bottom right. Those we have different resistances there. And those you can do the whole grip or you can do single fingers. Theraputty, we brought some of that. It comes in different resistances or weights, and same with the rubber bands. So at the end, we're gonna all take a minute to come up and look at our tools and check them out. But also, so there's many everyday activities will naturally strengthen your hands. So as you mentioned, Julie, like knitting, just knitting and being intentional about that can strengthen your grip. Also gardening, cooking, kneading dough, folding towels, playing cards, doing crafts, carrying groceries, or painting. These are just everyday activities that will work on your grip strength. And so just remember these 4 things. Grip strength affects much more than your hands. It plays a role in your independence, and small amounts of regular activity can make a difference. And it's never too late to improve your strength. So, contact us if you need help with any of this. We're here for you. Are there any questions? Yes.
Well, this may not be, I mean, the balls are called stress balls, and I thought there was research that doing that somehow did help people feel less anxious or something. Do you know anything about that?
I don't have the training on the psychology behind that, but I imagine it's similar to if you have to like fidget or almost like stimming. Sometimes we squeeze things or fidget with things. Also, it's just helping with blood flow, and any activity you're doing that you're focusing on, it naturally will take the anxiety down because you're focusing on something else. So that's my educated guess on that.
Yes. Yes.
Is there a separate OT, group or whatever at West?
Yes.
Yes. But it's all Trinity Rehab, but yes, there's a separate team. Yes. We also have some screen forms if you want to take one and take it home and fill it out, and then you can put it in. We have a box in the reception office. You can stick it in the therapy box. Yes.
Does your grip strength tell you more about your body, the strength of your body, or is it just within your grip?
Yeah. Yes.
That was asked to me downstairs, and that's why I'm up here.
Yeah. Yeah. So it definitely does. It's an indicator of your overall health. How you're doing with all of your ADLs. Did you tell her to ask this question, Holly?
It was not me.
No,
It was not me.
one of the rehab patients asked her, and I said, well, let's ask them when we go upstairs, because I wanted to
We have a
come.
lot of people who say, this is
Yeah.
silly. Why am I doing this? This is silly.
Yeah, because a weaker grip, it can be associated with increased disability or like a longer hospital stay, more falls because of, maybe decreased balance, and just overall loss of independence. Yes.
Thank you.
Yes. And if you also are interested, I brought the dynamometer, and we'll have like a separate area, and you can come up and have your grip strength tested if you'd like. Okay?
Don't be shy.
Yeah.
Come on up to the table.
Yes, let's do it.
Let's see what you got.
Can we turn more lights on? Or I'll do it. I will make you get it.
And just getting out of your chairs.
We'll have a fun therapy.
We do.
You're number one.
Yeah, well, that's going great. You're close. All right, Rolly, so I'm great. All right, now
And